I'm Dr. Aisha Samin. I'm a gynecologist and I've been working since last 32 years. And from these last 32 years, the last 22 years I've worked as an in charge in a government hospital. That is in government hospital, Karachi. So anyway, when we were taught about gynecology, breast was always a part of examination, and we had to start with the breast. And those who did not comply with this were, kind of thrown out by our professors. So I would like to just briefly summarize the things that everybody should know. And the first thing is the self-examination. I hope everybody believes in that, and I would like to call this group my girls. It's not and this and that. So girls, please listen to me. So the first thing which I would like to say is while you're examining your breast, you can do it every day while taking a shower. Okay? Is everybody listening? Now you can divide your breast into 4 parts. Can I
ask you one question?
Yes.
Why we need to check ourselves in shower? Why can't we do it like some sitting in a room? Or
because there's more a private place when you are in the washroom.
Or I thought maybe the water something has to do with that.
No. It's mainly the amount of water that you can just slide your hand over over the breast more easily. On the dry skin, it is usually difficult.
You're exposed.
You are more exposed, you are more private, you are more comfortable. So the first thing on which I would like to give stress is the self-examination, which you can do maybe once a week also. It is more than enough. So please divide your breast into 4 parts, imaginary 4 parts, right? Like this and then like this. These are upper 2 parts and these are the lower 2 parts. So the most common area where the breast cancer dies is the upper outer quadrant, near the armpit. So remember that never to miss this part whenever you are examining. So how you are going to examine is very simple. You can use the middle 3 fingers, right? And the pad of the middle 3 fingers you can just put over your breast and then circulate. You have to use 3 kinds of pressures, like a light, medium and a deep pressure. So if ever you feel a resistance in that case, there is some lump or anything, so just keep it in mind. But there are a few other points also which I would like to tell you instead of the lump. First of all is the lump, of course, in the breast or in the armpit. The other is thickening or swelling. If there is a sign of swelling or thickening of the skin, just please note it down on a piece of paper and just write down the dimensions. It was 2 centimeters or whatever the dimensions you think it was. And irritation or dimpling of breast skin is very important. If constantly there is irritation, you are constantly scratching your breast because of, not because of any other perspiration or any other thing, but if you have flaky skin, if you are noticing the flaky skin, so note that flaky skin, and if there is dimpling of the breast is the skin surface pulled inside, like a dimple on your cheek, like you have seen of Shah Rukh Khan or whoever. So, that's the dimpling of the breast that you have to notice. The other thing is the redness. If there is only redness on the breast and no other point, like there is no thickening, there is no other lump, just the redness, that is also important and to be noted. And if there is pain in the nipple area, the nipple area, right? There is a nipple and there is a brownish area surrounding it that is called the areola. So if there is pain in the nipple area or the areola, that is also very significant. Then what else will you examine by breast examination? It is the discharge from the nipple. Discharge from the nipple is very important. So you have to do it in 2 ways. First is like this, horizontally and then vertically. You pull the nipple first horizontally and then you pull the nipple vertically. It is a little bit painful, it's a little bit uncomfortable, but you have to do this as a part of the examination. And if you get secretions from the nipple, so you should note the color of the discharge. It should, if it is yellow, green or milky in color, you should note that point. That is also very important because these are the signs of early cancer, right? So, what is the stage 1 cancer, which I will limit myself to stage 1 cancer, which every, I think, the woman can diagnose at home. Early stage tumor, which is 20 millimeters or smaller, and which has not spread to more than 3 lymph nodes, which is not possible for you to diagnose lymph nodes. Do you know what are lymph nodes? Do you know what are the lymph nodes? And the little ball-like things in the armpit. Yes. So these 3 lymph nodes or more than that, then it is significant. And what is the important age group? In which age group we are looking for mostly? So the important age group is 50 and above. So we are in the danger group.
Above
50 and above.
80, 85, whatever.
85. But it can also happen in a younger age group. I have seen many cases in my family also who were like 35 to 45, between 35 to 45. So it is not mandatory that it will happen at around 50, but the common age group is 50 and above. So how to test for the breast cancer at home, which I have already told you. For the this left breast, you have to use the right hand, right? And the 3 fingers, middle fingers of the right hand, the inner pad, you can use the inner pad of the hand to just simply put pressure on all the 4 quadrants of the breast. So breast has got 4 quadrants, as I told you, divided into 4 parts. So the most common is this part, near the armpit. So please do not exclude this part. So you have to palpate this part. So for the right breast, you will use the left hand. And the inner 3 fingers of the left hand, you will again 1 quadrant, then the 2nd quadrant, 3rd and the 4th quadrant. Like this you are going to palpate. Then in the end, what is left is the nipple discharge. Nipple first horizontally and then vertically. इसको squeeze करके करना है कि अगर एक drop भी you are seeing a fluid or discharge coming out, so please note it down. It should not be greenish, yellowish or milky, right? Clear fluid ho, it's okay. That is because of increased prolactin levels or other endocrinological problems.
That's not
Yes, that's your domain. So once you have found out that there is a lump or something or any suspicious area you have found out, so it is very simple nowadays to diagnose it. First is the palpatory method. आपने घर में कर लिया, जिसको देख लिया, there is a suspicious area. Immediately you have to report to the doctor. What the doctor is going to do is first is the ultrasound. Actually, ultrasound में उन्होंने देखा कि एक तो suspicious area उसको भी मिल गया, ठीक है? Then is the mammography. Then we will go for the mammography.
Ultrasound has to be done before mammography.
Yes. First,
you can't go mammography directly after.
No, never. You have to take the first step first and then the second. Don't go into the invasive procedures first, because mammography itself has got radiation. अगर आप बार-बार अपने आप को radiation से expose करोगे तो जिसको नहीं भी हो रहा होगा उसको भी हो जाएगा, ठीक है ना? तो first it is a simple ultrasound, then the mammography. Suppose it has been diagnosed that there is a suspicious area which has to be investigated. So what they do FNA. What is FNA? Fine needle aspiration. They put a needle inside the breast and see that suspicious area. Sometimes ultrasound guided or sometimes by palpatory method also you can go to that area. They take the syringe out and a small piece of that suspicious area comes out, and immediately it has to be fixed means it has to be put into alcohol and other things and then sent to the laboratory for histopathology. Over there, they will categorize it whether it is simple, which is called benign, or it is malignant or cancer. Then cancer has got further classifications, which very briefly I am going to tell you, right? So that you should remember this. So, what are the causes of this breast cancer? Does anybody have any idea?
And there are lots of maybe like
Yes.
as beauticians, we know there are lots of chemical we are using on our body. Maybe they'll just go absorbed inside, and the family background also comes.
Family background is very
I mean, if your mother and mothers and the mothers have
a very strong
family,
family. Yes. So there's breast cancer gene 1, and breast
gene one,
cancer
yeah.
gene 2.
Yeah.
So that will be evaluated later on, but also for those mothers who have not breastfed their children. Breastfeeding is very important because the whole fatty tissue, the alveoli, the lobules, and the ducts, they become active and they secrete, they make the milk and they give excrete it through the nipple, and which is a very healthy procedure. So, what is the most important site for the cancer? This is the upper outer quadrant, which I told you, which is near the armpit, right? So, what I want you to know is that there are 4 stages of breast cancer. Please know this because in ultrasound report you will get this, and you can immediately categorize yourself. You are doing an ultrasound report, the doctor is writing that the tumor is more than 5 centimeters. So where you are standing, at least you should know this much. So just remember T1, T2, T3, T4. T1, T2, T3 and T4. They are very simple. I am going to tell you now. T1 is tumor when the tumor is 2 centimeters or less. Just remember, 2 centimeters or less. If you are getting the ultrasound report and the dimensions of the suspicious mass is 2 centimeters or less, then this is T1. Easily curable with surgery, no chemotherapy, usually no radiotherapy is required, right? चीनी नंबर का आपने देखा होगा, उनका भी early stage में था, the record therapy. What is the real cause what you are saying? Suppose a person is coming from a family who don't have a history of breast cancer.
Yeah.
Usually we are saying that it's hereditary breast cancer gene 1 and breast cancer gene 2. Suppose she doesn't belong to that family. She's coming from a normal family. But what happens is that when you read your textbooks, anyway, I will tell you that there are certain cells in certain period of life that get mutation. Do you understand mutation?
Yes.
Yes. They become pleomorphic, their nuclei double, they become hyperactive and they start multiplying. And it is from the God side usually, but they can be environmental factors, like she has been exposed to radiation, like she's working in the radiology department, or being exposed to so many other things.
Okay.
So mutation is the answer to your question. Okay, T1, everybody remembers 2 centimeters or less. T2 is tumor more than 2 centimeters but less than 5 centimeters. Between 2 and 5 is T2. What is T3? Tumor more than 5 centimeters. If it is within the ultrasound report that it is more than 5 centimeters, please be alert. T3, T4 are vigorous treatments and everything. So what is T4? Tumor of any size, even 1 centimeter, of any size growing into the chest wall or into the skin. स्किन में आ गया है, चेस्ट वॉल में घुस गया है, मगर है बिल्कुल छोटा सा 1 सेंटीमीटर का है. वो 1 सेंटीमीटर इतना खतरनाक है कि it's metastasizing into your chest wall or the skin. So sometimes it is not only the size, sometimes it is the destruction that the tumor is doing around it. So please remember this. And how fast do the breast tumors grow? Breast tumors double in size in 180 days, in 6 months. So please do your examination at least once a week, which is mandatory for each and every woman, especially women around the age of 50 and above. And then there's nipple discharge. I have already told you that is really shallow or milky. So these are the very simple things which everybody can do at home, and of course you should never delay your appointment with the doctor, and the doctor can do the examination, a very friendly examination, and she can tell you, yes, I can feel something, go for an ultrasound, go for an mammography, go for FNA, the FNA might be negative, so you are free to go, and if it is positive and in the early stage, the only thing is surgery, that is lumpectomy. Nowadays they don't remove the whole breast, only that part of the suspicious area. So the rest of the breast is left as it is. So it is very simple, so you can get it done. So I hope I made myself clear. Was it simple?
Yes.